Folks ready? All right, good morning. I am pleased to be joined today by Marty Martinez. He is our Chief of Health and Human Services. Earlier, Chief Hooley was with us over at the mobile vaccination site across the street. Certainly want to thank him and the entire EMS team. Also want to acknowledge Kate from BHA and Sheila Dillon, who is our Chief of Housing, for their amazing work. I also want to lift up the residents over at MLK Towers for accommodating this important vaccination center. This residential community that is home to more than 100 seniors and adults with disabilities. We appreciate their hospitality as the City of Boston works to bring more life-saving vaccines to the neighborhood. We can all play a part in helping the City of Boston's recovery, reopening, and renewal as we move through the COVID-19 pandemic. Over the past few weeks, my staff and I have volunteered at the MLK Towers vaccination clinic, knocking doors, talking to residents, and assisting with appointments. Many residents are eager to receive the vaccination. Others have questions and want more information. I'm pleased to share that today is my turn to receive a COVID-19 vaccine. I became eligible like other Bostonians who volunteered at vaccination clinics. I'm choosing to get the shot because vaccination is an important tool to protect ourselves, to protect our communities, and all those that we love, and to help stop the pandemic. Vaccination is at the top of our COVID-19 agenda. The City of Boston is pursuing a citywide approach that is focused on equity. We know that people of color are more likely to get COVID-19, and if they do, they are more likely to die. That means addressing the needs of the entire city as we target those that are hardest hit by the public health crisis. A powerful example is the Equity and Vaccine Access Line. This is the direct phone number or an easy online form Boston residents can use to help schedule a vaccination appointment. The Equity and Vaccine Access Line is intended for residents who are currently eligible for a vaccine and are part of populations inequitably impacted by the virus. When residents call, and I'm going to give you this number, so please get the number. When residents call 617-635-5555, they can press 1 if they are a Boston resident age 65 or older, or they can press 2 if they are a Boston resident who is currently eligible to get vaccinated and identify as a person of color. Then a real person will take their names and contact information. Residents can also provide their contact information by going online and visiting boston.gov/getvaccinated. Again, that's boston.gov/getvaccinated. Residents who call or use the online form will receive a call back from a member of the Health and Human Services or Age Strong staff to schedule an appointment on a first-come, first-served basis. The latest data indicate the Equity and Vaccine Access Line is making an impact. People of color currently represent 45% of the vaccines that have been distributed in the City of Boston. We will continue to make progress by implementing proven strategies and new approaches. New approaches require new ideas. So today I am pleased to announce the Vaccine Equity Grant Initiative. Through the Vaccine Equity Grant Initiative, the City of Boston is committing $1.5 million to support nonprofit organizations creating equitable access and breaking down barriers to access for Bostonians who have been disproportionately impacted by COVID-19. This grant funding will prioritize partnership models that bring together vaccine providers and community organizations. The Vaccine Equity Grant Initiative Awards will support both clinical and wraparound services that create true vaccine access. The Vaccine Equity Grant Initiative will support direct in-person outreach, to help residents get into vaccine appointments, public awareness efforts that build confidence in vaccines and their effectiveness, additional wraparound support such as transportation and language interpretation, and direct clinic support for on-site and after-hour services. This approach was informed by the Public Health Transition Committee of My Transition, co-chaired by Frederica Williams and Dr. Lauren Smith. So I want to acknowledge and thank them for that amazing work, as well as our Chief of Health and Human Services, Marty Martinez. As we begin a new chapter in our city, we are inviting new partners to the table in our fight against COVID-19. While all partnerships will be considered, the Vaccine Equity Grant Initiative will prioritize partnerships or organizations that have not previously been fully engaged in this work. Health and Human Services will lead this process in partnership with the Boston Public Health Commission, starting with the request for proposal on March 31st. I look forward to announcing the awardees in mid-April. The arrival of spring and the rollout of vaccines bring new hope to our battle against COVID-19. We all want to live our best lives. We all want to enjoy the beautiful spring weather, but we must remain vigilant against the virus. The latest COVID-19 data makes clear our fight is far from over. In Boston yesterday, we saw 335 new confirmed cases for a total of 62,874. No new deaths were reported, thankfully, keeping the total number at 1,331. And 164 people recovered, bringing that total to 59,119. We must remember that COVID is still with us. More than half of the new cases in the past 2 weeks have come from Bostonians under the age of 29. We must all continue to the practices that keep us safe. Boston, let's keep wearing our masks, washing our hands, keeping our distance, avoiding gatherings. And when our turn comes, please, let's get vaccinated. Thank you, and now I'm happy to take a few questions that you have for myself or Chief Martinez.
Mayor, what's your opinion of the governor's rollout of the vaccination effort here in the Commonwealth and how it has affected that effort in the city of Boston?
Well, I think there certainly have been a few bumps in the road early on, particularly regarding the supply of vaccines and getting that from the federal government. Those supplies are increasing every single day, and I'm grateful to partner with Governor Baker, all of our state partners, certainly the legislature as well, our congressional leaders, the White House, and our local partners here in the city of Boston.
Are there things you would do differently right now?
I think it is important that we continue to do the things that we see are making an impact. I am particularly excited about the mobile vaccination clinics that meet people where they are. A couple of weeks ago, when I was here at the MLK Tower, I had the opportunity to knock on several doors, to talk with residents. Many were very eager to come down and get vaccinated. Some still had questions. And so through those conversations, talking with residents, I was very pleased to help encourage some to come down and get vaccinated. Today was their second opportunity to get their second shot. So coming back and seeing some of those same residents get fully vaccinated is very rewarding. And so I think it is important that we continue to do things that are working. I'm really excited about this new grant opportunity to bring new people to the table in an effort to combat this disease together.
Do you think that was one of those conversations you had with someone who was reluctant? What did you say to them? Did you see any realization from them that, okay, maybe I will be able to, lead them in the direction of getting vaccinated?
I think there is an issue around lack of information and misinformation. And so when residents have questions, it is important to get the facts in front of them. And so not just through my conversation, making sure that we have medical professionals on site, doctors on site, who can answer any questions that residents may have. Sometimes it's not fear of the vaccine, but residents may be on other medication. They want to understand how they will that medication will impact the vaccine. So it's just important that we provide good information and the facts.
Would you take any steps with respect to making the vaccine available to school teachers in Boston as a means of getting them back in the classroom soon?
It is very important that we ensure that our school teachers have access to the vaccine. Proud of the work that we are already doing on that front to ensure that our educators get the vaccine. We want to open schools and make sure that they are safe for not just our teachers, for our families and other staff. So that is very important, and that is a priority for me.
What you're doing in that regard?
Well, there is, I believe, a site, and I will let Chief Martinez fill you in on that site, if you like. Yep. Chief Martinez?
Sure. Thank you, Mayor. So the City of Boston and the Boston Public Schools have been vaccinating educators, K-12 educators. We opened a site at the Gallivan Community Center in Mattapan, creating access for teachers there. We created access through priority slots for teachers through the Reggie Lewis Center in partnership with Tufts Medical Center, and have created a lot of access. Thus far, we believe probably close to anywhere between 60% of K-12 educators have gotten access, and we're want to make sure that everyone who wants it can get it. So BPS, under the leadership of Dr. Casilius, has made sure we're going to do that, and the mayor's been clear we need to continue that effort.
And at what point will you feel it's time for the teachers to get back in the classroom? At what percentage of vaccination?
Our school teachers are prepared to come back into the classroom at the after school vacation in April, and that is great. And we are working with our families to help them understand all of the protocols that we have put in place that will ensure safety. And so that is our plan thus far. We will continue to monitor the data and be informed by the data.
On BPS, the state recently this week granted the city's request to push back the reopening of full-time elementary. Can you just speak to why that was necessary and why that's important?
It is important because, again, we have to do this responsibly and safely. Teachers just recently became eligible for the vaccine despite their strong advocacy to get vaccinated earlier. We have to ensure that more educators are getting the shot, and not just our educators, all of our support staff. And we believe that this extra time will help us do that.
As you've taken this new position, as you had all the briefings leading up to it, was there anything that surprised you about the vaccine effort, or the effort to battle the coronavirus here?
What was that? The last part?
Just anything that surprised you in the effort, the vaccine effort to battle the coronavirus in general?
Yeah, I don't know if I would say a surprise. I remain encouraged by the way everyone is coming together, from our health providers and medical institutions, certainly our own amazing team working through the City of Boston, and community partners who have come to the table, who have really stepped up their efforts to ensure that we're getting good information out to residents, and that we are providing a way for residents to get in contact with folks who can help them get appointments. And so I remain encouraged by that, and I think we need to continue to do that, and our new initiative will help us do even more of that.
Does the city or have any special strategies to stop the spread or slow the spread among people below the age of 30?
You know, they will become eligible a little later, so it is really important that we remember this pandemic is impacting all of us. It is not just impacting older residents. In fact, the biggest growth that we are seeing are in young residents, and so it is extremely important, particularly since they're not eligible now, to remain vigilant in terms of social distancing, avoiding gatherings, washing your hands, and wearing masks. You know, my hope is we will have the supply needed to meet that demand when everyone is eligible. But in the meantime, we have to do everything we can, not just to protect ourselves, but those we love.
Mayor, I know that you were one of the people who was previously on the fence about whether or not you would get the vaccine when it first became available now you are going to take it today. Are you hoping to encourage other people of color to get it past their hesitancy? And can you talk about the conversation you had with yourself in deciding to get vaccinated?
Yes. So, as a person of color, I too have experienced racism in healthcare. I know other folks have as well. I think it is important to point out here that people of color are no less hesitant or more, they're not more hesitant than other groups. They are not more hesitant than other groups. So there is some hesitancy that people have, and it is important that we get factual information out. I know in communities of color, sometimes people reference the Tuskegee experiments and the lack of treatment or the treatment that was denied to African Americans. And as we think about this vaccine, we cannot let the vaccine be held back from communities of color. So it is important that we take the steps necessary to get the information that will help people make informed choices. The vaccine is essential for our recovery, reopening, and renewal. People are anxious to live their best lives. I want to make clear this is not about getting back to normal. Normal was hurting too many folks with health gaps as well as wealth gaps in the city of Boston. We have to ensure that we come out of this pandemic stronger than before and a much more equitable city than before. And so really important that we get information out, get the facts out so that people can make informed decisions. I am trusting the data, I am trusting the science, and I want to lead by example for anyone who still has questions or hesitancy around the vaccine. And that is why it is very important that those who are in a position to get the vaccine, whether they be faith leaders, community leaders, anyone who has any kind of influence with folks here in the city, to lead by example. And so I am pleased that I will be able to get it today, and I encourage those who have any questions to speak with their own doctors or to come to call us. We've got a great team who can receive their calls and answer any questions that people have, but it is extremely important that we do everything we can to battle this pandemic. It is not over, and the vaccine is the thing that will help get us to the other side. Yes.
When's the last time that maybe...
I'm going to ask our chief to come.
When's the last time that happened? That sounds remarkable.
Yeah, so the question about whether or not there's been other days with no deaths. There's been a few days sporadically thrown around where there has been cases where we haven't had deaths, which we're thankful for. I think we're also going to see as more older Bostonians and older residents get vaccinated. That's why we're also seeing a decrease in hospitalizations and ultimately a decrease in deaths. So that's a really important piece. I think in the city, we've done a great job in partnership with so many of vaccinating older residents. I think our latest data from about a week ago shows about 70% of folks over 75 have been vaccinated, and about 70% of folks over 65 have been vaccinated, and that's the population that's most likely to be severely impacted.
Thank you. Last question. I want to save some time to get a photo with these beautiful children who are here. Last question.
Going off of what Yahoo asked earlier, are there any initiatives to stop people, like especially geared at younger people? It sounds like younger people are really driving the spread. Is there anything?
I think we have to continue to provide information, engage those who may be working with younger populations or connected to younger populations to help them understand the importance of doing everything to keep themselves safe so that they don't continue to spread, this virus around. I am looking forward to the day when everyone will be eligible and that we have enough supply to get everyone in the city vaccinated. Thank you. Thank you very much.